Hello everyone, welcome back. Today we're so gratefully joined by Michelle, an ex-psychiatric nurse who's going to be guiding us through the condition obsessive compulsive disorder, also known as OCD.
Hi, my name's Michelle. I used to be a psychiatric nurse many years ago, in and out of hospitals, dealing with a variety of different conditions, but OCD didn't tend to be one that cropped up in the hospital scenario. It tended to be something that was dealt with at home, and often somebody who suffers from OCD tends to hide it a little bit, even from friends and family if they can. Obsessive compulsive disorder, or OCD as it's short, basically derives of obsessions, which are the thoughts that can be intrusive and quite horrible for the sufferer, and the compulsions, which are basically the rituals or acting out of the obsession, in the hope that your mind thinks it's going to make it a little bit easier, but actually it doesn't. There can be varieties from hand washing to things just not feeling right, to touching things several times. It can have a variety of manifestations, and in varying degrees it can cause the sufferer to be feeling hideous, basically not even able to get out of the house sometimes. The most common that people probably know is hand washing. People can wash their hands goodness knows how many times for a length of time. It might have to be 4 seconds, it might have to be 4 minutes. If it doesn't feel right, they might have to repeat the ritual over and over and over again. People do tend to hide this. So it might be, they make up stories, I just needed to be there a little bit longer, when in actual fact the obsession and the ritual is taking a time-consuming time for them. And it has an impact on their family too, because obviously it's time-consuming and it's something that you feel quite powerless as a relative to do something about. The two most common treatments for OCD tend to be drug therapy, SSRIs, which combat the thoughts and the chemicals, basically, and the imbalance that's caused, and CBT, or cognitive behavioural therapy, and that challenges the habits and the way of thinking. These obviously aren't the only forms of treatment you can use. A lot of people find things like hypnotherapy, because it reduces the anxiety, can be really, really helpful for them. You can also have talking therapies, just speaking to somebody and expressing, how you're feeling at that point can sometimes, again, lessen the anxiety. Usually a combination of several of those treatments tends to work for most people. There's lots of things out there that you can tap into, especially if you don't feel like you want to talk to family or friends. You've got OCD UK, they work in a similar way to Mind in that they have information. There's forums, there's websites. You've also got Samaritans, 365 days a year, 24 hours a day. It's free, so you can call somebody like that anytime. A lot of the forums are quite nice because it makes you realise that you're not actually alone, and there are other people who do exactly the same. Sometimes you might think to yourself completely bizarre and absurd things that you're an intelligent person and I shouldn't be touching this thing 14 million times or however many it is. And it's nice to know that somebody else feels the same way. Contact these websites, contact Mind, contact somebody. Don't just suffer it. There's no need to.
Thank you so much for joining us today, everyone. And thank you to Michelle. I really hope everyone found this useful at home.